The inflammatory response. A non-specific defense response to damaged or injured tissue cells. This type of innate immunity occurs when pathogens enter the body through abrasions or irritations. It is the body's attempt of disposing of foreign microbes, bacterium, and toxins. This response is the body's protective barrier to prevent the spread of infection to other tissues and cells in the body. Common characteristics and symptoms include heat, redness, swelling, and pain. In some cases, inflammation can also cause a loss of mobility in the affected area. There are 3 stages during the inflammatory response: vasodilation, immigration or diapedesis. Finally, tissue repair. Here's how it works. The skin is one of the first lines of defense for the body. The layered keratinized cells create the epidermis layer, providing a physical protective layer. In the dermis, we have cells which act as guards for when this first line of defense is broken or penetrated. These include mast cells and dendritic cells, whose job is to communicate with helper T cells when necessary. We then have the interstitial fluid and the capillaries. Within the endothelial cells of the capillaries lie red blood cells and types of white blood cells, including neutrophils. When the skin is penetrated, for example with a pin, the first line of defense is broken, causing pathogens and other foreign particles to enter the body. The bacteria begins flooding the interstitial fluid. The cells act immediately, beginning to release chemicals called chemokines. The mast cells begin to release histamines into the interstitial fluid, traveling down to the endothelial cells walls of the capillaries, causing them to expand and widen. This is called vasodilation. An abundance of fluid, including red blood cells and white blood cells, flood this area. This is the cause of swelling, redness, and heat. The endothelial cells of the capillary walls become more porous, allowing cells to move between the walls. Neutrophils and helper T cells squeeze through the dilated walls. This is known as immigration or diapedesis. This is where phagocytosis occurs, as the phagocytes consume the foreign particles as well as the dead cells which died in the process. This process of the battle between cells and foreign bacteria will continue until the site of injury is free from pathogens, reaching homeostasis.